What if surgery didn't require a surgeon's hands directly touching your body? Instead, a robot performs the operation. This is a robotic surgical system in action. And in the United States, it's already being used in thousands of hospitals every year. But how does it actually work? Let's go inside the procedure. Before the surgery begins, the patient is placed under anesthesia. Then, the surgeon doesn't stand over the body like in traditional surgery. Instead, they sit at a console. A high-definition 3D camera is inserted into the body, giving an ultra-clear view of the surgical area. Every movement is magnified. Every detail becomes visible. Now, the robotic system comes into play. The surgeon controls robotic arms using precise hand movements. But here is the key point. The robot does not act on its own. It is fully controlled by the surgeon in real time. The robotic arms translate every movement into extremely precise micro-actions inside the body. This allows for smaller incisions, less blood loss, and faster recovery in many cases. The robot can rotate instruments in ways the human hand cannot. It can reach deep and narrow areas with incredible stability. This technology is commonly used in procedures like prostate surgery, heart surgery, and gynecological operations in the United States. But it's still not magic. It's precision engineering combined with human skill. At the end of the procedure, the instruments are removed and the small incisions are closed. Many patients recover faster compared to traditional open surgery. Less pain, less trauma, and shorter hospital stays. But here's the most important fact. It is still the surgeon making every decision. The robot is just the tool. The future of surgery is already here. Subscribe for more 3D medical animations, surgical procedures, anatomy explanations, and medical technology insights.